So I went into medicine because of the challenge. I always liked science. From a young age, I knew I wanted to be a doctor. And so it was kind of a natural fit to combine science and people. And as I got older, I really enjoyed the relationship aspects of medicine. And so in doing different rotations and training, from working the ERs to surgical rotations, as much as I enjoyed the procedures, I really found that there was a lot of value in building relationships and getting to know people, getting to know a community. I enjoyed all aspects of care, from birth and from prenatal care, obstetrics to pediatrics and adolescent medicine to geriatrics and sports medicine. And so family medicine was kind of a natural fit for combining all of those. An average day in family medicine is hard to describe because it can be so varied. So it may be a day where you get to tell someone exciting news that they're going to have their first child. It may be a day when you patch up somebody's child and they broke their arm while they were sledding or snowboarding. There could also be a day where you have to walk through what it looks like for a grandparent who's starting to walk down the lanes of dementia and walking through the next steps and caring for them. And it could also be as devastating as having to tell somebody who you've known for years and have a relationship with that they have a terminal illness. So I enjoy the challenges. I like having to think through difficult cases. I enjoy the relationships and getting to know whole families and really getting to know and understand a community and the health of a community and how to improve that. I like the challenge of trying to identify barriers in healthcare and how we can break those down and deliver high quality healthcare all the time to anybody. And those are challenges that are never going to go away and never going to be completely solved. And so it's fun to try to make progress and be a part of a great team to deliver care in this area. So I found KMHC when I was a resident and I was moonlighting in the ER here one night a week. And I really saw firsthand how people here work together. And that was probably the one thing that just stood out above other places that I'd worked, other clinics, hospitals, ERs, urgent care, is that it truly was a family feel here. People knew each other. And I think one of the rare things here, and it hopefully becomes less rare over time elsewhere, but is that there is a really strong working relationship between the administrative staff here at KMHC and the board and the physicians and the staff who work here. So I choose to practice here because I love the people. It's a great team and network of staff, and it really doesn't matter if a person is working in any part of the hospital. There's really a team aspect and a family aspect here. So it doesn't matter if you are emptying trash cans, or you're working in administration, or you're working in the lab draw station, or you're working as a medical assistant, or as a physician, or PA, or nurse practitioner, or anybody in between. Everybody here works together. I think the number one reason is the people here. I think there's a huge community involvement. That'd be reason number two. And really a drive to meet the needs of our community. And I think the community has felt that and sees that, and they respond back with trying to help figure out, again, ways of building this community to be stronger, building a better healthcare. One goal is to try to make the world a better place by using the skills that God has gifted me with and the desires and the way He's kind of wired me. I don't know how to say that in any other way. I don't take any credit. I feel like I enjoy hard work, but really, in the end, I have a lot of spiritual beliefs in that God is directing a lot of this. And so this is a way that I can love on other people and serve others and try to make the world a little better place in the community that I live in. Oh, it's exciting. I hope the future looks like physicians and clinicians having more time with their patients as we try to smooth out electronic medical records. I hope it looks like higher patient satisfaction in the care that we deliver and higher employee satisfaction. Not that it's low, but you always want to seek to be better. I am excited to think about just the different services that we've been trying to recruit and have been recruiting, and seeing some of those plans come to fruition as far as more surgical specialties or specialty care delivery, and really just kind of continuing the progress that's already been made. I'm Nate Saylor, and I choose KMHC.